Hello, and welcome back. In chapter 16, we're discussing the final passage, dying and bereavement. So, social cultural definitions of death. All cultures have their own view of death. Mourning rituals differ from culture to culture. Some of the most famous structures on earth result from customs regarding death. So, legal and medical definitions. How to determine that a person is dead? A clinical death. The death of the lack of heartbeat, respiration. Standard definition for hundreds of thousands, hundreds of years. Whole brain deaths. Several criteria. No spontaneous movement in the response to any stimulus. No spontaneous respiration for at least 1 hour. Total lack of responses to painful stimuli. No eye movement, blinking, or pupil responses. No postural activity, yawning or swallowing, or no motor reflexes. Whole brain death part two. A flat EEG for at least 10 minutes, and no change in any of the criteria when tested 24 hours later. Whole brain standard is used everywhere in the U.S. Some medical professionals call for a single assessment or a simpler one. Some religions find brain death controversial. Persistent vegetative state, situation in which a person's cortical function ceases while brainstem activity continues. Person does not recover, does not allow for consciousness. Family member faces difficult ethical decision regarding what to do for the person. So we talk about ethical issues when it comes to death, or talking about end of life. Bioethics, the study of interface between human values and technology advances in health and life sciences. This is based on respect for individuals' freedom and the impossibility of establishing any single version of morality for a rational argument or common sense. Euthanasia, the practice of anyone's life for reasons of mercy, usually is a scenario when a person is being kept alive by machines and has a terminal illness. Should a person be able to make the judgment that another's life should end? Active euthanasia, the deliberate ending of someone's life, like administering a drug overdose. Continue to talk about euthanasia. So, path of euthanasia, allowing a person to die by withholding available treatment, disconnecting a ventilator, not getting chemotherapy treatments. There's controversy regarding whether there's really is a difference between active and passive euthanasia. Many people in the U.S. have religious reasons for not supporting euthanasia, especially active forms. In Western European, it tends to view active euthanasia positively. Eastern Europeans and Muslims tends not to, right? Case regarding euthanasia often end up in court. Physician-assisted suicide, the process in which the physicians provide dying patients with a fatal dose of medication that the patient self-administers. Physician-assisted suicide, most people support for terminally ill people in great pain. The Netherlands became the first country to officially legalize physician-assisted suicide. Oregon and Washington have laws that support it with some restrictions. There are 3 requests have been made by the patient, spaced 3 days apart. Why do people start thinking about their own mortality at midlife? Start to think about how long they have left to live. Can lead to changes in occupation or strengthening relationships. Older people are usually more accepting of death and less anxious about it than of the younger agers. The trajectory of death depends on the type of illness. We talk about green line, which is a clear, rapid period of decline. A red line, which conditions some periods of rapid decline followed by recovery. And gold line, a long-term chronic condition that results in death. So Kubler-Ross described 5 reactions that represent the way people deal with the process of death: denial, anger, bargaining, depression, and acceptance. Right? Not everyone experiences these in the same order, but those are going to be the stages of death in terms of Kubler-Ross. So Core identified 4 dimensions of the types of tasks dying people must face: bodily needs, physiological security, interpersonal attachment, and spiritual energy and hope. A holistic approach that recognizes the coping efforts of a family member and caregivers as well as the dying person. Constant mom and Thule emphasize the social environmental context within it, how dying occurs. Death anxiety. People's anxiety and fear about death and dying. Very existential concept. Terror management theory addresses the issue of why people engage in certain behaviors in order to achieve particular psychological states based on their concerns about mortality. Brain activity in the right amygdala, cingulate cortex, and the right caudate nucleus is associated with death anxiety. Why might people express different feelings about death in public as compared to their thoughts when they're alone, right? Again, because out in the open, you may feel this way, not want people to understand how your concerns and whatnot. When you're alone, you have those deep times you have times for deep thought. Some degree of death is appropriate, but too much can interpret daily functioning and routines. So how do people normally deal with death anxiety? Teenagers often engage in risky behaviors. Exercises such as writing your own obituary can help you lower death anxiety. Death education programs exist to combine presenting factual information about death and reducing fears and anxiety. In the life issues, management of the final phase of life. After death, dispositions about their body and memorial services and distribution of assets. Most people want to discuss arrangements, if any, given a chance. Allows one to consider the traditional care and alternatives. People can make a will to make sure their wishes are carried out. Final scenario, talking about end of life issues. People making their own choices are known about how they do and do not want to their life to end. Affirming love and resolving conflicts and relationships is an important part of the process. Healthcare workers recognize the importance of the final scenario and give patients a chance to create one. Help family and friends to interpret the person's death and open communication. Hospice is an approach to assist dying people with emphasized pain management or um, palliative care and death with dignity. Focuses on the client and the family and helps them to approach death. How is hospice care different from care of patients receiving in the hospital? So people decided on hospice care when they have cancer, AIDS, cardiovascular disease, and other terminal conditions, and when they are in their last 6 months of life. What do families need to consider before choosing hospice? Is the person completely informed about their prognosis of their health condition? What options are available at this point in the progress of disease? What are a person's expectations, fears, and hopes? Do people in a person's social network communicate well with each other? Are family members available to participate actively in terminal care? Is a high quality of hospice care program available? Is hospice covered by insurance? Traditional medicine has been influenced by hospice. Pain management interventions. Family members should honor the dying person's wish for hospice or alternatives. Most people fail to tell family members what they want to happen to them at the end of their lives. How does one make intentions known? A living will is one way. A document in which a person states his or her wishes about life support and other treatments. Healthcare power of attorney. Person appoints others to act as his or her agent for healthcare decisions. In order for legal methods to work, relatives and physicians must know about the existence of these documents and where they are. Um, do not resuscitate order. A medical order that means CPR is not started should the heart and breathing stop. So self-determination and competence evaluation. A major concern regarding end of life decisions is whether the person is cognitively or legally able to make them. The capacity to make decisions is a clinical determination. The competency is to make decisions is decided by the court. Bereavement, the state of condition caused by loss through death. Grief is the sorrow, hurt, anger, guilt, and confusion and other feelings that arise after experiencing a loss. Mourning, the ways in which we express our grief, right? This is influenced by culture. Sometimes you can see people wear black, attend funerals, and other things to actually deal with mourning. So there's no right way to grieve. Again, culture can play a huge role in that. Grief involves changing and coping, and is an active process that deals with acknowledging the reality of loss, working through emotional turmoil, adjusting to environment, and in which the disease is absent, losing ties to the deceased. Grieving is a highly individual experience, usually taking at least 2 years. I mean, a year to recover from a loss, sometimes two. People usually do not recover from their loss. They learn to live with it. Sadness, denial, anger, loneliness, and guilt are typically reactions to grief. Grief work, the psychological side of coming to terms with bereavement. So the four component model posits that dealing with grief is a complicated process that can only be understood through a complex of outcomes that unfold over time. Helping grieving people involves helping them make meaning from their loss. Encouraging people to express grief may not be helpful. Grief work is the rumination of hypothesis. Views extensive grief process as a form of rumination that it may increase distress. The dual process model of coping bereavement. It integrates loss-oriented stressors concerning the loss of itself and restoration of oriented stressors related to moving on with life. And the dual process model posits that dealing with stressors is a dynamic process. Explains how it is possible for people to be overwhelmed with grief one day and handle life well the next day. So, complicated and prolonged grief disorder. A complicated and prolonged grief disorder distinguishes from depression and normal grief into the terms of separation distress and traumatic distress. Separation distress. Its symptoms include preoccupation with the deceased to the point where it interferes with daily functioning, upsetting memories of the deceased, longing and searching for the deceased, and isolation. Traumatic distress. The symptoms include disbelief about the death, mistrust, anger, and detachment from others as a result of the death, feeling shocked by the death, and experiencing the physical presence of deceased. Um, the American society tends to distance itself from death, right? It uses euphemisms such as passed away, eliminates many rituals, right? How can people learn about death in its natural context, right? This one, the one's always thought about that. That's the existential question. At 5 to 7 years of age, children realize that death is permanent and happens to everyone, and biological functions cease to exist. Bereavement in the childhood does not usually have long lasting effects. Explanation regarding death should be kept simple and facilitating understanding. Children need to know that it's okay to feel sad and show their feelings. Researchers believe that it's important for children to attend funerals of the loved one and or have a private viewing. Adolescents, 47% of college age students experience a death of someone close to them. Teenagers sometimes have trouble making sense of death. Bereavement sometimes involves chronic illness, guilt, low self esteem, poor school job performance, and substance abuse. Many young adults believe that peers who die are cheated out of their own future. Losing one's partner in young adulthood is very traumatic and usually unexpected. Desire to stay connected through memories must challenge basic assumptions about themselves, relationships, and life options. Losing one's child is perhaps the worst type of loss. Many parents recover and may end their relationship with with each other. High anxiety problems and functioning and disrupted relationships with another children are common problems. Parents who lose children through stillbirth, abortion, or or neonatal death are often overlooked. Losing one's parents often leads to redefining relationships with other family members. Losing a parent at a young age can lead to worries about dying young. When older parents die, the adult child is usually more accepting of death and happy that the parent's suffering is over with. Older people usually experience death of those close to them as traumatic. The loss of a child still causes intense grief and they can last decades. Losing a partner later in life is deeply personal loss. Grief can occur for as long as 30 months. Survivors with close confidants are better off than those with many acquaintances. Older women tend to sanctify their deceased husbands. Gay and lesbian couples often face other feelings and reactions on top of normal grief. And we understand that death through an interaction of psychological and social cultural forces.